This is Aging Forward, a podcast from Mayo Clinic about the science behind healthy aging and longevity. Each episode, we explore new ways to take care of our long-term health, the health of our loved ones, and our community so we can all live longer and better. My name is Kristen Meinzer. I'm a writer and journalist, and I'll be filling in for Dr. Chen for the next several episodes. This episode, we're talking about hearing loss. About 1/3 of older adults experience hearing loss. And as we age, the chance of developing hearing loss increases. But hearing loss is about so much more than merely needing to turn up the volume. It can mean having difficulty hearing sounds at certain frequencies, hearing less clearly, or having difficulty distinguishing between the conversations you're having and background noises. And our guest today says that this difficulty in communicating can lead to a very isolating experience. Dr. Cynthia Hogan is a clinical audiologist based at Mayo Clinic in Rochester, Minnesota, who works in the Mayo Clinic Hearing Aid Program. Her research focuses on the impact of hearing loss, and today she'll break everything down about hearing loss, from signs to possible treatment options to the latest technological advances that can help. Dr. Cynthia Hogan, welcome to the show.
Thank you so much for having me. I'm glad to be here today.
Well, this is a very important topic we're discussing because about 1 in 3 adults between the ages of 65 and 74 have hearing loss. What, Dr. Hogan, is actually happening with the ear that makes this more likely as we age?
The ear has 3 main parts. It has the outer ear, which is the part we can all see with the ear canal. It has the middle ear, which is the eardrum and consists of those 3 little bones connected to the eardrum, and then the inner ear. And it's the inner ear that seems to take on the most damage over time as we get older. That inner ear has 2 parts. One is the hearing part, which is called the cochlea, and the other is the vestibular portion of the ear, and that is for our balance. And so inside the cochlea, we have thousands of tiny hair cells, and they're all lined up in nice little rows if everything is perfect. But as we get older, we're exposed to noise, we're exposed to medications and other trauma that we don't even think about, and that impacts those little tiny hair cells in the inner ear.
So it's not just that we're losing hair on our heads as we age, we're losing the function of the hair in our ears.
That's correct. Yep.
So in addition to what's happening with the hairs inside that inner ear, are there other changes that are happening in the ear as well?
So technically beyond the ear, we know that the hair cells connect to the hearing nerve or the 8th nerve. And without stimulation of that 8th nerve, we know we lose some neurons or some of those nerve fibers. They don't respond like they do when they're stimulated routinely. And so we have this interface between the ear and the brain that also is accumulating some malfunctioning portions, so to speak. Then in addition to that, as we get older, we have some changes in our brains. We often don't process sound as well. We need people to speak more slowly. Everyone who speaks slower speaks more clearly. And so speaking slower helps an aging brain process sound a little better. And also reducing noise can help with that as well.
Now, Dr. Hogan, you mentioned the 2 main functions of the ear are to hear and to maintain balance. How does that capacity change as we get older?
As we lose those hair cells in the cochlea or the inner ear, the hearing portion of the inner ear, it changes our sensitivity to sound. So what we find is that a sound that we maybe used to hear at a really soft level now has to be amplified or turned up a little bit. And We also know that the vestibular or the balance part of the inner ear also has tiny hair cells. That helps to keep us upright so we don't fall. And those can also be impacted by aging. We also need our vision and we need our proprioception.
What's that?
The sense of our body in space. If you close your eyes, you know that you're sitting or you're standing, but your sense of your body in space can also change with aging. And often we talk about dual sensory loss of vision and hearing together. So if our vision helps us to keep our balance a little bit, we lose some of that.
Wow.
And we have a higher risk of falls.
So many functions working together to help things work or maybe not quite work right. And it's a lot to think about because a lot of times when we talk about balance, we're like strength, flexibility, agility, but there's so much else going on there that we might not be thinking about day to day. So what are the effects of normal aging on the ear and what are signs of something more concerning?
I would say typically what happens is we start to lose some high frequency hearing. And so often what a lot of people will say, I can hear, but I can't understand. What happens is we're missing out on some of the high frequency parts of speech. In English, those sounds tend to be the S, F, TH. Those sounds help give us the clarity that we need to understand words and distinguish words. And so when we miss those and we hear all the vowels, it sounds not as clear. Oftentimes associated with hearing loss, we also have some tinnitus or ringing or buzzing or humming in the ears. And there's a lot of varied theories about what causes that. It can be the hair cell damage, the nerve damage, and there are some studies that show functional MRIs. There's activity in the brain in the hearing portion of the ear when somebody has tinnitus, and that suggests that it's similar to phantom pain. The sound isn't actually present in the environment, but our brain is acting as though there's a sound there.
So ringing in the ears and difficulty hearing certain frequencies of sound, these are normal effects of aging.
Those are normal, yeah.
What is abnormal then?
So abnormalities typically are going to be a sudden change in hearing. Hearing loss with aging is very gradual, typically. So if somebody wakes up one day and has lost a lot of hearing overnight, if somebody has bleeding from the ear, if somebody has a severe episode of dizziness with vomiting, potentially imbalance and inability to stand up without falling, those are all things that you definitely want to see your physician about.
And what are some of the unexpected causes of hearing loss aside from aging itself?
We know that trauma, injuries can cause hearing loss. Some of those can impact the physical anatomy of the ear, perforated eardrum, for instance. But we also know there are lots of medications that can cause hearing loss. We call those ototoxic medications. They're toxic to the ear. And those tend to be very strong antibiotics and chemotherapy drugs. So often you're going to get a lot of counseling related to use of those drugs before you even start them. And we know that noise exposure can make hearing worse. And there's a lot of data that shows that people may have a genetic risk for noise impacting them more than, say, a typical person who doesn't have that same risk. For instance, some Native American populations have a higher risk for middle ear infections, or drugs may impact somebody in a different way because of something in their genetics. We know that there are over 150 genes associated with hearing loss. Some of those are associated with a syndrome, like Usher syndrome, where individuals develop hearing loss and it gets worse typically. And then there's non-syndromic hearing losses. So there's a lot of people who have no genetic cause, or they might have a genetic cause not associated with a syndrome.
Also, infections can be the cause of hearing loss.
Yes. So we do think of infections in little ones, babies, toddlers, and people know of somebody who's had tubes in their life because they had a lot of ear infections. They go to the doctor and they put a little tube in to aerate that ear space. But oftentimes people will grow back into a phase where they might have ear infections again. And some of that can be related to eustachian tube dysfunction. So, our ears feeling full or pressure in our ears, that eustachian tube isn't always working properly.
Got it. Are certain health conditions going to make somebody more likely to develop hearing loss?
Yes. So we know that often individuals with cardiovascular disease, individuals who have diabetes also have a higher risk. Individuals with chronic kidney disease, those who have arthritis have a higher incidence of hearing loss.
What about lifestyle factors like drinking or smoking? Do those have any effect on hearing loss?
There is some data to suggest that smoking isn't good for hearing.
Okay.
We do know that tinnitus, or ringing, buzzing, humming in the ear, can be exacerbated by things like nicotine, alcohol, caffeine, and stress. Stress can really impact somebody's ability to sort of tune out tinnitus.
Caffeine, too? Really?
Yeah. Sorry. If your ears are ringing, you might want to cut back on the caffeine and just see, keep a little diary and see if it changes.
Okay. All right. When someone is experiencing age-related hearing loss, how does their experience of hearing actually change? You mentioned they might not hear some of the S's and T's, certain frequencies. What other things might happen?
So I would divide potential outcomes into different things. There's some emotional outcomes that come with hearing loss. Some people can become a little more anxious if they don't hear everything. They're worried about missing something, or they misheard something. People can get a little paranoid because they're not sure is someone talking about them, because they're not hearing the conversation that's going on somewhere else in the room. People can get depressed. They say, I'm not going to go to book club today because I know I don't hear some of the people in my book club. And so they start to isolate. And then we also know that there are some situations where people's physical activities, they might change. If somebody rides a bike and they are concerned for their safety because maybe they can't hear somebody coming up behind them, they might start to change their lifestyle a little bit to accommodate for the hearing loss and stop doing some of those activities that they get joy from.
This goes so far beyond, I'm just going to turn up the TV 2 more notches.
Yes.
When it starts causing fear or frustration or paranoia or isolation, it sounds like.
And I think what happens is, we internalize stress. When we have trouble hearing, it puts an extra what we call cognitive load on our brain. We hear with our ears, our eyes, we pick up a lot visually, and the context. You can miss a few words in a conversation and figure it out. But when hearing loss gets a little worse, it's a lot harder to figure it out. And so what happens is your brain is trying to fill in those blanks. So your brain is busy taking care of that. You're not aware that somebody's doing something near you. You can't be really paying attention to 2 things at one time if your brain is worrying about trying to fill in the blanks of the things you're missing in a conversation.
Our brains are already working so hard to keep so many other things on the tracks.
Exactly.
But then to try and interpret and guess and fill in the blanks and perceive all these other things around us, that must be an enormous load.
Right. Yeah, people, they don't know how to articulate it. But as we talk to them about this, and if I say, Well, how do you feel at the end of the day if you had a busy day at work and you had a lot of meetings? And a lot of people, if I say, "Are you tired?" they say, "Yes, but I never thought about it that way." Because they really think they're tired just because they did their normal work. But they're not realizing that they're working harder than the person beside them who has normal hearing.
All right, let's talk about how to treat hearing loss. First off, I imagine one of the difficulties is we might not always know that it's time to go see the doctor about it.
It may not be the individual with hearing loss who realizes what they're missing. If you didn't hear it, you don't know you missed it, right? So it could be a family member or multiple family members who might be saying, "Mom, you're not hearing very well," or "I noticed that you were quiet during dinner." So I think listening to people around you because they care about you and they're not trying to pick on you. And it never hurts to get a baseline. So I think if someone says something to you about your hearing or is wondering about your hearing, I think that's a good sign that you definitely want to see your physician about.
And what do these appointments typically look like?
You know, primary care physicians have different kinds of screening questionnaires and things they can ask. So they will already have done an ear exam. They've looked in the ear, they've removed wax if there's wax. So we know that's not it. But if that's not the case, then they'll send you for a hearing test. And they'll typically send you to an audiologist. And in a hearing test, what we do is take a case history. So we get information about your lifestyle, your risks for hearing loss, family history. And then we do a hearing test where we have you listen to a variety of different tones from low to high pitch. And we're checking to see how loud do those different tones have to be. And that tells us about the sensitivity and about that inner ear and the middle ear. And we do that test two ways. We do it through headphones, which is sort of what everybody thinks of. But there's also another component called bone conduction testing, where we put a headband on the head, and that test bypasses the outer and middle ear and goes directly to the cochlea, directly to the inner ear.
Wow.
We test the same tones and we look at the results of those two different tests. And then that tells us if the hearing loss is in the inner ear or the middle ear. And we can then send somebody to a physician. If it's a middle ear problem, maybe they can have surgery or medication. But if it's an inner ear problem, then they are sort of stuck with an audiologist to help them manage.
At what point do you actually know it's time for a hearing aid versus tough it out a little bit longer? You're going to be fine. Or, maybe you just need to practice more conscious listening.
Yeah.
How do we know the difference?
So what I start with is when somebody has a milder degree of hearing loss, I really want them to evaluate their lifestyle. Because a lot of times people come to us because their spouse is telling them they're not hearing very well. And when I ask, well, can you give me an example of what that might be? I talk about multitasking as something we do a lot at home. And it could be they're both in the kitchen. Multitasking in the kitchen is very common. So we might have the radio on to hear the evening news. We're working on dinner. We have the fan on over the stove. We have water running in the sink because we're rinsing the lettuce. We're doing all these things that have noise associated with it, and we aren't even looking at each other. We may be back to back, or one of us has our head in the refrigerator or the cabinet. And we're not going to be able to have a normal conversation under those circumstances. If it's something like that somebody's just starting to have difficulty with, sometimes improving their communication strategies can help. So a lot of what we do is counseling. Turn off all those things that you don't need to have on and get the other person's attention. Look at them. And then once you have their attention, then ask them the question or tell them the story. Face-to-face communication. And so if those little things can improve your ability to communicate, then maybe you put off getting a hearing aid for a while. Sometimes little things like if the biggest difficulty is television and one spouse is turning it up and the other says it's too loud, sometimes instead of turning up the overall volume, go in and turn up the treble instead of turning up the overall, because we typically start to lose the high frequency hearing first. So in addition to having trouble with clarity, people will say, I hear men's voices better than women's voices. So if you turn up the treble, you may not need to turn up the overall volume as much.
So that's the best case scenario, when you can give someone these tips and they can manage without a hearing aid. But earlier, you mentioned that if someone has a middle ear problem, they may need surgery. Tell us about that.
So if somebody has a middle ear problem, that means something's wrong with either the eardrum or the three little bones in that middle ear, what's called a conductive hearing loss. The middle ear isn't getting sound to the inner ear, to the cochlea. And that type of hearing loss may be remediated with a surgical procedure. But that's not the most common type of hearing loss. That's only about 10%. It's more common in children who have chronic ear infections.
So in the majority of cases, are the rest going to involve hearing aids?
Yes, some type of amplification.
Okay.
So part of that hearing test, we also evaluate when we make speech loud enough, how clear is it? Because we can certainly tell you how loud things have to be for you to hear, but depending on how much damage there is, the words might not come through clearly even when we turn them up. And so it's important for us to know, if I make sound loud enough, can you make sense of it? Is it clear? Is it understandable? And that has implications for your prognosis with the hearing loss. You know, if you understand most of those words, then we believe you're going to do great with the hearing aid.
You said hearing aids mostly are about raising the volume. How does that work in terms of background noise or different pitches of voice?
You are right. As we amplify sound, a lot of times people will say, but then I hear everybody else in the restaurant. And so hearing aids have some noise reduction strategies where they use multiple microphones to try to reduce what's behind someone or beside them and try to focus a little more on what's in front of them. But hearing aids still do not have noise canceling, which is, I mean, that's really sad. You know, a hearing aid is a machine. And even with machine learning that happens now in the development of hearing aids, it's not as smart as our brain is. But before someone becomes a candidate for a hearing aid, they can consider an over-the-counter device. And an AirPod Pro, the second and third generation, are some over-the-counter devices that work really well for people who have really mild, maybe moderate hearing loss. And once they have that hearing test, they can actually program their phone so that their AirPod Pros can act as a hearing aid. And they do truly have noise reduction.
Oh my gosh. Technology has come so far. That's incredible.
Yeah. And I mean, I have one patient who also is currently trying out the Meta glasses with the transcription. And, you know, it's really helpful for her. It's like live captioning on her glasses.
Wow. Fascinating. In addition to hearing aids, medication, or surgery, is there anything else that might be a possible treatment?
Not really at this time. We can't reverse that permanent inner ear hearing loss yet. There has been a lot of research. The little hair cells can be grown, but as of now, they still can't be connected to the brain.
All right. I have kind of a sad question here. there's an idea out there that once it's gone, it's not coming back.
Mm-hmm.
Is that really true of hearing loss?
It is true, unfortunately.
Oh.
Yeah. What we want to do is continue to stimulate that hearing nerve. So, having some of those frequencies turned up a little bit so that that part of the nerve continues to get stimulated. And so it tends to lead to better long-term clarity if somebody is listening to sound that's amplified appropriately. And so hearing loss is one of the most modifiable things that we have in our repertoire. We don't have to have hearing loss because of noise or because of medication, or if we stay healthy and don't have diabetes and cardiovascular disease. So there is a lot we can actually do to try to prevent us getting hearing loss.
How can everybody listening to the show protect their hearing in their day-to-day life?
So first of all, I would say if you are turning up headphones or earbuds and somebody says, I can hear that, that means it's too loud. So moderate how you turn up the volume on things. And again, turn up the treble rather than the overall volume and see if that helps you. Another thing you can do is not go to noisy activities without hearing protection.
Mm-hmm.
If you know you're going to a concert, I know people don't want to wear hearing protection, but a hearing protection is going to help you be able to hear that music longer.
Yes.
In your lifetime. So having some that you tuck away with you, that you bring with you, and you can get very inexpensive earplugs that are specific to music so that music still sounds good. I would say reading your medication inserts that tell you what all the potential side effects of the medication are. One of the things, though, is that if hearing loss is a potential side effect of a medication, your physician is going to tell you that.
As far as protecting my ears now,
Mm-hmm.
I use earplugs when I'm at concerts and even at movies sometimes because some movie theaters are so loud now. But what about when I was young and dumb and I would go to concerts all the time and I would not protect my ears? Is that affecting me today because of what I did when I was in my teens and 20s?
So you will likely not really know until you have a hearing test. There's a pattern that's very specifically associated with noise-induced hearing loss. And the only way to know if you have that is to have your hearing tested. But we know that there's a lot of redundancy in our hearing circuit. There's lots and lots of hair cells. So if you lose a few, you're still going to hear pretty well. So what you did in your 20s hopefully is not going to impact you long term. And hopefully you took a break from what you did in your 20s, in your 30s, and didn't just keep doing those same bad noise habits.
All right. Are there any tools or resources you would recommend to listeners out there who are concerned about preserving their hearing, testing their hearing, making the most of what they still have with their ears?
Well, Mayo Clinic does have a book on hearing and balance, which is a great resource. It starts at the very beginning about the anatomy of the ear and talks about treatment and covers all aspects of the ear. That's through the patient education at Mayo. And I would say some of the professional organizations like the American Academy of Audiology, the American Speech, Language, and Hearing Association. There is a Hearing Loss Association of America, HLAA, which has a lot of helpful information for people. And you'll see articles in AARP magazines about hearing occasionally. And so really, the internet is full of information, but you do have to be careful about what you believe.
Do you have a story of a patient who got their hearing treated and had a successful result?
One of my recent experiences was an older gentleman, who came in with his daughter, and she was really prompting him to do something about his hearing because she felt like he was missing out during the first conversation that we had. I think some of it was guided by her feeling that maybe her dad didn't understand some of it. And she wanted him to get this certain type of hearing aid that she just insisted was going to be right for him. And so I did fit him with those hearing aids. And she came in for the fitting, and he was doing pretty well. But he came back for a follow-up after that without her, completely independent, and was hearing so much better. And he said, I want to try the other kind of hearing aid, because I think that would be better for me. And it was just nice to see him be confident and come in independently. And I think that probably gave him more confidence to work with his daughter, too. You know, he was hearing better. He wasn't missing out on things. It didn't seem like maybe Dad didn't know what he was doing. I think she probably saw a change in him, and he was very successful with behind the ear aids. He's going to meetings again that he said he had quit going to because he couldn't hear. And it's just nice to see people engage again, you know, and they're not as concerned, stressed, worried, doubtful.
Wow.
It gives them more confidence.
That's like turning back time. I think that's such a reassuring story, especially for people out there who might be like, if I get a hearing aid, people are going to think I'm old, or I'm not really at that stage in life, am I? And I think it's so reassuring to hear, like, it's this thing that will make your life so much better. There's no reason to shy away from it. And I'd also add, at least based on my observations, a lot of hearing aids now, I can't even see them. I have friends with hearing aids, and they have to point it out to me. I don't see them at all.
Absolutely. We have a saying that sometimes your hearing loss is more obvious than the hearing aid.
Yes.
Because you're missing things. You're answering questions inappropriately because you didn't hear the question.
Yes.
Or you heard a different question. And let me just add, almost every state, or perhaps every state now, has some kind of a trial or a test period with real hearing aids. So if somebody wants to try hearing aids, you can go to your local provider and potentially get tested, get hearing aids, and find out if it's for you. If it's not satisfying whatever it is your goals are for yourself and your hearing, then return them. But you won't always know if you don't try.
And there's no risk.
You might have to pay some small fee, but generally it's not a very large fee. I mean, here at Mayo, we refund the full cost of hearing aids if somebody returns them.
Are there any scientific advances that you're really looking forward to when it comes to treating hearing loss?
I think we are getting closer and closer to potentially some supplements or other things that we could take that might reduce our risk of losing hair cells. I would say it's going to take some time to develop the scientific proof that it actually works the way some of it is touted. But they can grow hair cells. We just have to get them connected. So I think that will also change in the future. Because if we can reduce the incidence of hearing loss, I mean, people can participate a lot longer in life.
Absolutely. Finally, Dr. Hogan, what does aging forward look like to you, and how do you personally age well?
Well, I have decided that I need to take care of myself at this point in life because I am going to retire probably in a few years, and I want to be able to get on the floor with grandkids. So I have started working out and eating better and trying to reduce my risk for everything. I already have arthritis. I can't stop that. But, you know, if I keep moving, that helps. At this point in my life, I'm trying to look forward to being healthier for my future.
I love that. Well, Dr. Cynthia Hogan, this has been so fantastic. I've loved hearing everything you've had to say today. Thank you.
You're welcome. Very happy to be here.
That's all for this episode. Hopefully you're feeling a little more informed, inspired, and empowered. If you have a topic suggestion for a future episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Aging Forward episodes and resources, head to mayoclinic.org/agingforward. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others find our show. Thanks for listening, and until next time, stay curious and stay active.